Welcome, everybody, to the Athletes for Hope podcast, Hope Heroes. We're so excited that you can join us here for another episode. It's an exciting one. This is a special one. It's been in the works for a while. My name is Dr. Mena Mirhom. I'm a sports psychiatrist and AFH's Chief Wellbeing Officer. And we've had a chance over the last few episodes to highlight incredible stories of athletes, former NBA players, NFL, MLS, really all around the sports world. And today we're in for something special. You're not going to just only hear the athlete vantage point, but who's behind the scenes? Who's helping the athletes flourish and do well? We've got two incredible clinicians with us today that I'm excited to be just in their presence. Two who are just friends of mine that I got to learn a lot from. And I'm excited for you to get to know them, to see their work across the NHL, the MLB, and really beyond. So let me get it started and introduce our amazing panel here that we've got today. All right. So we've got first Dr. Alicia Naser, who is just doing incredible work across the NHL. I came across her work. She's on Sportsnet, she's on media, on TV, on talking to clients one-on-one, a BCBA, a board certified behavioral analyst, and a PhD, which is just a lot of degrees all at once, I think, for somebody who's an incredible clinician. And all this experience in the NHL, one-on-one and speaking with teams as well. So just welcome, doctors. Thank you
Thank
for
you so
being here
much.
with us.
Thank you for having me. I'm looking forward to it.
Yeah, me too. And then we've also got Dr. Jorge Aguilar, who he is a legend across the MLB. I would say he is one of the reasons that the teams are going as far as they do. He is a longtime Yankee fan like myself, supporting the right team. We're supporting live. We're shooting live from New York, so
Oh,
it's the Yankees
you
are
have
the home
choice.
team. Okay, I'm sorry. But just MD, PhD, an incredible clinician, researcher, scientist, speaker, writer, just somebody who's all around an incredible force and presence in Major League Baseball, in psychiatry overall, right over there in the incredible institution of Montefiore. So a local friend too. We were both doing work in the South Bronx there. So welcome, Dr. Aguilar. Thank you for being here.
It, it's an honor to be here. I'm pumped. Thank you.
Me too, man. So before we dive into, we've got a long list of questions to pick your brain for the athletes that are with us kind of checking this out. I just want to give you the floor for a second to walk us through a little bit of your journey. How did you each get to be where you are? To be able to treat athletes. It's not something that people oftentimes plan 10 years in advance.
Mhm.
So just curious to get to know a little bit more about you.
Would you
Sure.
like me to begin?
Should we flip a coin?
Go ahead. You could take it.
Sure.
Okay.
So I, I, I went to medical school thinking I'd be a pediatrician,
Mm,
and I did not have sports on the radar at all. I even went into pediatrics residency, and it was during that time that I realized that I was not meant to be a pediatrician. I was meant to be a child psychiatrist.
mm.
It's like I belonged in a children's hospital. I was in the right church. I was just sitting in the wrong pew.
Okay.
So
Oh,
I
man.
converted to child psychiatry. And on that journey, I stumbled upon sports psychology as a field
Mm,
and have just been bewitched by it, haven't been able to look away and have been pursuing it wholeheartedly. And so now I only work with athletes.
mm,
Some of them are kids, but they're still athletes, many of them
mm.
professional. And I take a lot of pride in that. And it's been just a dream ride for me.
It's fun.
Love that.
Sports is fun.
Yeah.
Yeah.
Actually, similar to you, started in pediatrics. My brother Nassar, he has autism.
Mm,
And so I started working with children and individuals with special needs and specifically the world of autism. And so for about 10 plus years, neurodevelopmental disabilities. And I got into sports in a very unconventional way. I think kind of like everybody sort of does in a way, unless it's the thing that you start off with is it was during COVID. Everyone was at home, and that's really when a lot of podcasters or content creators took off.
mm,
And so at the time, I was also working in a clinic, but we were home working in the clinic doing supervision virtually. And at the same time, I was posting content online about general psychology concepts, but translating them into behavior analytic terms.
mm.
And what happened was a hockey player had reached out to me via DMs on Instagram and said, "Hey, one of these strategies that you posted really helped." And so that kind of got me thinking that if I had just got a little bit more niche specific with the population demographic I was working with, I could take behavior analysis and apply it to professional sports.
Mm.
There are behavior analysts who do work in health and fitness and sports, but so far as I know, not in an applied setting with professional athletes in the way that I'm doing right now. So it kind of took off really as a result of just posting for fun and to wanting to educate during a time where social media was the only medium that I had to use. And then from there, I just made it a little bit more niche specific and really hit the ground running with that.
I love that. And I love how both of your experience, I mean, it's one thing when you're working with an individual,
Mhm.
but there's something about working with athletes that lends itself well to sort of the pediatric population in terms of
Mhm.
understanding systems,
Mhm.
whether from the developmental side or from the child psych standpoint. Can you speak a little bit about why, when you're speaking with an athlete, right, when you're talking to somebody now who's watching, the treatment is rarely just like you do one thing, but versus it's the system around you. How do you approach treatment with somebody, understanding that we got to look at the big picture? We got to look at the family system. We got to look at the team system. How do you kind of have that approach? And how does that inform, the treatment style that you've got with athletes when you're looking at the big picture like that?
Yeah. So if it's okay, I'll start with this. It's from a behavior analytics standpoint, it's really looking at interlocking behavioral contingencies. So what that means is all of the multiple things that are happening in somebody's environment. There's
Mm,
never just one component or one variable that's impacting their behavior, whether that be their behavior on the field, on the ice, or their behavior at home if they're
mm,
doing their homework or whatever the case might be. There's always some influence from the environment, but the context, the environment is never just, rarely is it ever dwindled down to one environment.
mm,
We are human beings who function in all different areas, in sports, in school, in clinic, at home. And so it's really important to take into consideration all of those different environments that a person is coming into contact
mm.
with and how the variables, the things that are happening in that environment are impacting their behavior, and even so much, even sometimes not just impacting their behavior in that moment, specifically in that environment, but sometimes I'll see an athlete who, especially for, maybe you see this as well, but for the younger athletes and that are still, let's say, like 18 or younger, where maybe something at school is impacting how they're behaving and how they're performing in their sports,
Mm.
or something at home is impacting their performance in sports. And you don't know that unless you take into consideration all of the things that could be happening in all the different variables. So from a behavior analytics standpoint, it's about assessing, doing a functional analysis, which is just an assessment of behavior in all of the different environments and contexts it's occurring in.
Mm.
That makes sense. That makes sense. In child psychiatry, you rarely work with a kid and just the kid,
Right.
Mhm.
because if you want to set them up for success, you want to equip that kid with skills and also, as much as you can, influence the environment immediately
Mhm.
around them, their parents, the school, etc. And I see the same thing in sports
Mm.
to equip our athletes for success. We give them tangible skills and tools, and then, if possible, also work with their coaches, work with the
Mm.
league,
Yeah.
work with their families, work with their family members,
Mm.
because the milieu is so critical for
Right.
an individual's success.
Yeah. One thing I'll say, just to piggyback on that, is if I'm working with a younger athlete, I tend to just work with professional pros, so they're older. But if I am working with a younger athlete who's 18 or younger, I'll always make it a requirement that I'm meeting with the parents often
Mm.
for parent training, because I will tell them anything that I do is not going to be effective unless you're
Right.
also implementing it at home.
Right.
Because something that occurs is, this intermittent reinforcement, which means that a behavior when you're performing in sports, the coach might be on board and I might be on board on how we're going to go about optimizing a young player's performance. But if parents also are not on board,
Mm.
then the behavior that we want to decrease is being intermittently reinforced at home, which
Right.
impacts the effectiveness of how quickly you can see change too. So parent training, and that's where, like, to the point about pediatrics, is I spent so much time in pediatrics doing parent training for
Mm.
children with autism that it really actually translated well, which was something I wasn't expecting to sport.
I love that. And I know we were talking about a similar case even the other day of just
Oh
kind of
yeah.
how the system of it all. And
Hmm.
I'm always struck by how challenging it can be to get the whole system on
Yeah.
board, right?
Yeah.
You're working maybe with the athlete, maybe you can get the coach on board, but it's a big coaching staff. Maybe
Hmm.
one coach is on board and one coach isn't. How do you sort of take that approach, whether it's a pro athlete or a collegiate one, when you're saying you want to respect the privacy of the athlete, but at the same time, to your point, you don't want to work on something one day and have it be undermined by one of the assistant coaches. So how do you kind of balance that, making sure that we're going to make a plan together? Because I remember hearing this quote last week at a conference that mental health is the ultimate team sport,
Yeah.
right?
It's
And
true. Very
any
true.
team
I like
sport,
that.
baseball, hockey, soccer, whatever, if there's one link of the team that's not pulling its weight or sort of is working against the rest of the team, you're not going to get health.
Hmm.
How do you get the team on board when you're treating an athlete?
Well, from my standpoint, what I first look to is like, what's the goal? and how do we allow for everyone to see the benefits to them by achieving that goal. And then also assessing the behavioral repertoire of each individual. Maybe a parent doesn't have a certain skill that they do need to maybe follow through with how we're going to respond to a child athlete, or maybe the coach doesn't have. I found coaching is actually very I find great joy in it because coaches want to get better at what they're doing and they want to coach well, but sometimes they're just missing a skill set that allows for everyone to be on board aspect. So it's really about what's the main goal and how do we get everybody to see that there's benefit for them in it, and then who is missing a skill that they need to be all on the same page.
I love that.
Yeah. Yeah, I agree. One of the main differences between working with a general population and an athletic population is that there's these couple of things that are already hardwired into athletes and coaches and trainers. And I think one is this inherent desire to continually improve. And then second is this innate unity, cohesion, or at least an inclination to come together to accomplish a common goal. And so if we can help them identify the stigma against seeking mental help, for example, as a barrier towards achieving that goal, I think it can get everybody on board.
Yeah. And I think too, that's incredibly important, not just to be reactive, but to be proactive about it. Because I think I would like to see it happen a little quicker, but I think we're getting better at people, that stigma. There's more awareness around the benefits of receiving mental health support for athletes, but it's more in a reactive way where if it's proactive, everyone benefits.
Yes.
So it's like really integrating it into the system for athletes, of a comprehensive package of tools.
Yeah, and it feels like the leagues are getting there. Like I know in the NBA.
Yeah, it feels like it's getting there. Yeah.
Inching towards it, but still, like I'll give you an example. I was actually making a referral before we started to a therapist who was not involved with the league. And they were saying, you know what? I don't know. I feel like athletes sometimes have unrealistic expectations of therapy. So I don't know if I could take on an athlete as a client. When you're taking on, either somebody for medication management or therapy, and you want to lay down for them, okay, here is the awareness part about mental health, the integration, the prevention. But now they come in and they step in and they're in the zone. They're in the room. They want the self-improvement. They want to work with you. How do you set the stage for them in terms of what does it look like really? Like peel back the curtain for us for a second. For an athlete who's been hearing about awareness campaigns, who's seen a lot of, mental health is cool, you could totally do it. What does it actually look like to be working with you guys? What is the feel for it?
Yeah, my first encounter, first session with an athlete is often a lot like all the subsequent ones. It starts out with meeting where they're at, where I'm at. We kind of meet at eye level, and then I give them the floor in identifying what it is that they are struggling with what it is they want help with most, because they're the authority on what they need right now. And then I try to provide them something tangible, something helpful on that day, and then help them see how these tangible things can be strung together into a quilt as we continue to work together. And sometimes the threads on this quilt are purely mental health. Sometimes they're purely mental performance, and sometimes it's an interwoven fabric.
Yeah.
And we just won't know until we get started.
Yeah.
Can you actually explain that a little bit in terms of, for folks who are not familiar, let's say I'm just a ball player. I don't know mental performance, mental health, mental gymnastics. Like, what do these things even mean?
Actually, that was one of the questions in the question box that I put up that I got a lot of, is what's the difference between mental health and mental performance? I
Nice.
feel like you'd be a very good person to answer that question.
Yeah, that's an important question that I get a lot, and my answer seems to change here and there sometimes. And that's that, mental health work is about relieving suffering, right? It's the oath we took as doctors to relieve human suffering. And so if you're having debilitating anxiety, debilitating depression, whatever, my job as a doctor is to help relieve that distress for you so that you can function better. If an athlete comes to me for mental performance work, they're often looking for improved focus, right? Improved resilience, et cetera. And so we start where they want to start. And what happens often is because I provide both of these services, that we kind of end up going back and forth between lanes.
Mhm.
And it's quite beautiful because then it becomes clear to the two of us how these two things are kind of like a Venn diagram that
Mhm.
overlap.
Mm.
You know, it's really hard to have optimal mental performance with suboptimal mental health
True. Yes.
and vice versa.
Yeah. And I think sometimes athletes may not realize that there is a mental health component
Mm.
that they may be struggling with, and they may a lot of times it can be seen as just it's normal. This is
Right.
just what is. This
This
is
is all
just
they
how
know.
I am. Yeah. And I think if you get down to the bottom of it, sometimes as you're trying to optimize mental performance, you can then discover that there is a mental health area that needs to be addressed, which sometimes I find can be difficult if the client, if the athlete is unable to communicate or verbalize like what their experience is. But I think that's really important because the audience, I was surprised how many people submitted that question. And it was actually something even until I started working at sport that I was like, you have to just kind of distinguish between the two. Because to your point of getting to optimal performance, uh, if there are mental health areas that need to be addressed first and they're not,
Right.
kind of makes that nearly difficult, very difficult.
And sometimes, I don't know if you guys have seen this as well, in my experience, that folks may only have this come to the surface when, like anything else in sports, when there's pressure.
Yeah.
All of a sudden, you're in a slump. All of a sudden, you lost a couple games in a row. And then they step into you and say, "Can you help fix me?
Mhm.
I don't know what's going on." Or maybe they're not saying that. Maybe the coaching staff or the athletic director. I've had an athletic director come to me and say, "We lost this game. Fix this guy."
Yeah.
Fix this guy. I'm not here to work magic, man. How do
You're
you guys
not?
I mean, I can juggle, but it's but it's like, how do you guys approach that then when you're in the midst of, the speed of sports, right? You're in the playoffs now,
Mhm.
and we're under the crunch,
Mhm.
and can you guys fix my guy or not? How do you
Mhm.
kind of approach that if you're hearing that from a coach or a trainer or the player themselves and saying, like, I'm now struggling in this moment. We're not talking about prevention for next year. We're talking about, can I be better tomorrow?
Yeah, so I've been seeing that right now, especially because I work with NHL players and it's the start of the NHL season.
Mm,
We're about 9 games in, I believe, give or take. And, a lot of them went through well, all of them went through, preseason, but there was training camp and then preseason, and now we're in regular season.
mm,
And so you would see where maybe training camp wasn't so hot for some of the athletes,
mm,
or net preseason wasn't so great. And then it's like, "Well, wait, what's happening here?" And it's a bit jarring for the athlete themselves when they're like, "Why am I not performing, to
mm.
my best?" And now we're in regular season, and to your point, that's exactly what I've been hearing lately is agents will call or coaches will call or the
Yeah.
athlete themselves will reach out and say, "What do I do?" And that's getting kind of back to my point about the reactive versus proactive.
Mm,
But to what you were saying earlier about first trying to give them some form of relief of what's one little thing that I can give you right now to address the problem in the immediate, like right now, that's tangible, and we can do something with that. But then I think setting realistic expectations is really important.
mm.
Like, it takes some time. You have to train mental strength and mental endurance the same way you train your bicep muscle or any other muscle or speed, skating, the speed of skate. So I think setting realistic expectations, but also kind of creating a hierarchical structure of what needs to be addressed immediately, and then what other areas of their performance are impacted indirectly
Mm,
from the one problem that they're having, which usually is pressure,
right.
is the word I hear all the time. The pressure, or I don't know if you see this a lot, but athletes who perform better in home games versus away games. That's like
Mm.
a huge thing for coaches. Like, why?
Yeah.
It's like the mental performance just tanks for away games. I'm
Mm.
like, well, there's something to
It's the
that,
food,
but
man. It's
it's
the home cooking. Yeah,
yeah.
solved it. You're welcome.
Yeah. Yeah. So I think it's really about setting realistic expectations. But what I have found that I'm quite happy about and proud of, and grateful for is that the NHL players who started with me last season or the season prior,
Mm,
they now have realized the benefit of not starting in a reactive phase. And
mm.
so they stayed with me all throughout the off season, which is really great because then, yeah, they're setting the tone and the foundation to go into the season where they feel like they are in a place where they have tools to mentally recover emotionally if they need to. And if not, they're not in a panic about it because
Mm.
we've already established a working relationship and from a therapeutic standpoint have come to understand one another and what they need.
I love that. Love that. You don't want to wait until the fire to like figure out your escape plan.
Yeah. No, the worst time to learn how to put out a fire is when you're in a fire.
That's a good
Yes.
bar right there.
Yeah. That's what I feel like 5 reels on Instagram about this.
And that said, we will happily help somebody during the fire
Absolutely.
as much as
Oh, yeah, I'll
we
go through
will
the fire
work
with
towards
you.
preventing the fire,
Yeah.
right? We screen folks at the start of preseason. We check in on folks during the season, and folks get sent to us during the playoffs, during high pressure moments throughout the season when the player is struggling for whatever reason. Whatever it takes to help, we will do.
I think that's part of the job that I love about sport is that when they come under a high pressure situation, I feel the competitiveness and the high pressure of it. So for me, it's even more of a challenge, and I love it.
You want to
And
win.
and I'm like, okay, how do I help him?
Beat the performance
Yeah.
coach of the other team.
Yeah.
Alicia, I love what you were saying about setting the right expectations early on. I find that so important in my work as well. Oftentimes those expectations that folks bring into the room are based on inaccurate information.
Yeah, or models.
Yeah. Things like, believing that they have more control over what emotion they're experiencing than they
Yes.
actually do.
Yeah.
Or dogmas like you must feel confident in
Yeah.
order to perform well.
Yeah.
And so much of our work early on in that first session is debunking myths.
Yeah.
Wow.
And I think rediscovering a new frame of thought, and rediscovering a relationship to one's emotions. It's not, you don't actually have to feel confident to perform well. And even for the NHL players I work with, I tell them all the time, you already have the hockey. You know how to play. The hockey's not an issue. It's your relationship to when you feel frustrated or your relationship to feeling angry, that then impacts your behavior. And so it's really like, we're not trying to get rid of anger. We're not trying to get rid of nerves. Maybe one thing for the listener that can be helpful, I always have, it's a whole thing a strategy that I give them, but to kind of shorten it up is really to reframe nervousness as excitement. I would find it to be very strange if a professional athlete wasn't nervous.
Right.
Nerves mean you care, and caring is a really great thing. And when you reframe, even last night, actually, 2 of my NHL players were playing each other because they're on separate teams. I'm like, just don't fight each other. So,
or if you do, make it good.
Yeah, exactly.
Gloves off, the whole thing.
Yeah, drop the mitts. Yeah,
cool about hockey.
Exactly. That's it. One of them did, but the other, they didn't fight each other, so that was good.
They survived.
Yeah, but he had said to me that really helped a lot because I don't know what to do with the physiological response of nerves, but reframing it and labeling it as excitement really helped me to not feel like it was consuming me and debilitating.
Yeah.
I love that.
Yeah, hearing that reminds me of my physics course in college where my professor would go on the board and say, whatever we're going to talk about this year, it all boils down to force equals mass times acceleration. Everything derives from F equals
I don't miss
ma.
hearing that. I don't miss that class.
And so for us, regardless of whether it's performance anxiety, whatever, you name it, it can, in a way, always boil down to the athlete's relationship with their own emotions and thoughts. And improving that into a more healthy, a more effective and efficient and helpful relationship is kind of what it all boils down to. All roads lead to that.
Yeah.
So is that the way then, where when let's say I'm a ball player, let's say I'm one of the best franchises in the world.
Good luck.
Just saying. I don't care who's in the playoffs. I don't care. And I'm coming to you and I said like, all right, I've heard myths. We've debunked myths, but you're going to set for me sort of a healthy expectation. So the healthy expectation is that what I'm walking away with? Like, what would you ultimately want me to walk away from the first session? That way I know if I've never been to a first session, but this is like our little plug here to do the first session. Cause I'll tell you, I'll be honest with you. For folks who have never had a chance to sit down with 2 like cool, relatable people like you guys, it just feels like an invasive, weird, lay on the couch, tell me about your mom, like, you know what I mean? Like just
the couch.
the couch is, So how do you demystify that? Especially for dudes. Let's make it, I don't want to make it all gender, but like guys are not great.
No, it's a real thing. It's a totally real thing. Yeah, I get it. Yeah.
Yeah. Or 90% of my athletes are dudes. I totally get it.
I don't, mine are all male. Yeah.
Right. Mostly. And, and I think, where do we begin? I think I make it clear to them that we can still be helpful to them, even without them having to share those intimate details
Mm,
about their relationships and their
Yeah.
history.
Yeah.
That helps, but
mm,
it's not a requirement for
mm,
us to be helpful to them.
Hmm.
And then where I try to start out with them is by helping them notice, perhaps even for the first time in their lives, just notice that these are my thoughts,
Yeah.
these are my emotions, and this is me,
Hmm.
wow.
right? Here they are, and here I am.
Yeah.
Just to notice the spaces in between them,
Absolutely.
and not by telling them,
Mm,
but by showing them, by
Hmm.
having them feel it, experience
Hmm.
that there it is, and here I am.
Yeah. I think that's very helpful in a athlete seeing the power they have
mm,
and being able to diffuse, like going to acceptance and commitment therapy, is being able to diffuse from an emotion or a thought and then choosing a different one that's more productive or helpful.
mm,
I had a parent say to me one time, well, I try to tell him that he doesn't control his thoughts, or his thoughts don't control him. He controls his thoughts. I was like, well, I understand the sentiment, but it's not necessarily true
mm,
because as an individual, you feel like your thoughts are controlling you until you have the skills to see otherwise. So what I offered was to replace that with being able to choose which thought you want to have.
mm.
Because when you can choose, then you're putting power in the athlete's hand. But first, to your point, they have to be able to see that separation of like, this is a thought, this is an emotion, and then this is me. So I think that's incredibly helpful.
Yeah.
It really is, and just kind of, as you're saying, kind of the space in between
Yeah,
the things,
space is so important.
it's hard, and maybe, it's a good segue. We were talking a little bit off camera to one of our little commercial break here. One of our sponsors, the APA Foundation, has this incredible resource, and they help sponsor the podcast. It's called Notice, Talk, Act, which is simple but powerful because sometimes for you, just as you guys are saying, just to notice what's going on with me, but not only with me, but with my teammate.
Hmm.
What it means to be a good teammate is to know, I noticed how this person is struggling. And now but I don't know the language. I don't have the words to be able to say, "Hey man, you good?" Whatever the language there. So a very simple basic training, whether you're in the workplace, whether you're in a school, and we're going to help develop that in the sports world as well. And then to act, to take a very simple action. This is like CPR, right? When we all got trained in CPR, we didn't think we were going to go out there and run ambulances, but we at least know how to do a little Heimlich, how to save somebody who's choking. That framework that I really love from the APA Foundation begins to empower the player to say, I am responsible for my teammate in that way. As I'm learning to notice in myself, one of the things that I saw in players, which is really powerful, is as they learn from you guys and they learn how to notice their feelings, emotions, and their behaviors, they begin to see that in other people as well. So that's
Hmm.
something I just shout out to APA Foundation for putting that together, because a simple framework like that can be the difference between, seeing your teammates struggle and being paralyzed,
Hmm.
versus being able to take a step. So I actually want to pick your brain about that as you're sort of empowering the player,
Hmm.
as you're seeing that the athlete is learning more about themselves, learning more about their own emotions and behaviors. How do you sort of see that impacting their relationship with their teammates? What it mean to support, whether it's their friend, their teammate, somebody around them? How does that sort of help them be a better teammate, friend, brother, parent, you know, not just a better player,
Hmm.
you know?
Well, I think the talk element of the is really important because I always tell my clients that secrecy breeds shame.
Mm,
So the less we talk about something, the more shame we feel around it. And they find at least what they've self-reported to me, and I can visibly see it, is they feel a lot more relief just by talking about something. It's a wild the impact that just talking about something can have.
mm,
And, to that end, to answer your question, I've had a lot of my clients refer their teammates to me, which has been really wonderful to see, not just because I'm like, "Yes, I get, more clients,"
mm,
but it's because they feel comfortable talking about it,
mm,
and they are now coming from a place where it's not intimidating to be talking about it, but just normalizing it, and also because they know and you see it in a athlete's performance before anything.
right.
Like, in some of the questions that you had sent us, one of them was like, what is how does anxiety performance first show up
Mm,
even before they even verbalize it? And for me, a lot of times it's you can tell in their game when they're
mm,
not able to perform under pressure. So I think just the act of being able to talk about it because they now have seen the benefit that it has had on them and not wanting a line mate or a teammate to go through that, but then also it affects the team overall. If one player that they need is a strength in one area of the game and he's not performing well, the team's not going to do well.
Right.
So it benefits everybody if that guy's, gets some support. So, yeah.
Yeah, facts. So many of the athletes that I've helped came to me because they were referred to me by another athlete
Mm.
that
Yeah.
I had previously helped, or a coach that I had helped.
Yeah.
And that makes sense, because when you're drowning, it's hard to notice the other people that are
Right.
drowning, and
Yeah.
even less be able to help them.
Mm.
And so the more people we can pull out of the water, I feel like there's a synergistic effect that
Absolutely.
can happen. And so just helping one person on a team, you can see ripples of that throughout a season.
Yeah.
Mm.
It's fulfilling. I think as part of this work is very fulfilling when you see one athlete recommend another, or, it's really nice.
It's the positive domino effect, right?
It is, but I think it's especially, and maybe I'm biased here, but it's especially exciting to see happen in sport
Yes.
Amongst male athletes.
Yes.
Because if I go tell my girlfriend you should go see this therapist, it's like, okay, that's fine,
Yeah.
But to have an NHL player who is known for his role as maybe an enforcer, not so much called that anymore, but for fighting,
Right.
tell another teammate of his, I found great work working with Dr. Naser. And then I think it's just great for anybody,
Mm.
any performance coach, any sports psychiatrist, anybody. It's just really nice to see.
Yeah, our enemy is the stigma.
Mm.
Absolutely, yeah.
And the stigma is a very real enemy.
Yeah.
And it's most palpable. It's most, it's biggest and heaviest with athletes.
Mhm.
Mm.
And the data backs this up. And with male athletes in
athletes,
particular. And so when we see the chains move
Yeah.
with male athletes, for us, it's so rewarding,
It's so rewarding. Especially in the NHL. Like, I just love it.
Yeah.
right?
Yeah.
You get a room with 25, tough alpha
guys, yeah.
males.
Yeah.
And you do an exercise with them, and then by
Yeah.
the end of it, a third of them, you see a tear come
Yeah,
out,
yeah.
or hug one another. It's my
Yeah.
goodness, right? It's like, all right, game.
Yeah.
I guess we won, right?
Yeah.
Yeah.
That to me is winning. It
Mm,
really
yeah.
is. Because even if they don't win the game, or even if their performance was not so hot,
Mm.
they at least they weren't so self-critical after.
Yeah.
Mhm.
Yeah.
Or the world wasn't ending in their mind after.
Mhm.
Or if their coach maybe sat him for a couple shifts or what have you, to them, they were able to choose another thought and also allow the frustration or the sadness, the disappointment be something that they experienced
Mm.
without feeling wrong for experiencing that
Yes.
emotion.
When the
That's-
walls go down,
Yeah.
the thoughts go
Yeah.
down, and they start to
Mm.
talk in real
Mm.
ways to one another.
Yeah.
What it means to be tough, what
Yeah,
it really
absolutely.
means to be tough,
Mm.
Yeah.
not what we thought it meant.
Right.
Yeah.
what
Not
we were
dropping the
told it
meds.
meant when we were growing up.
And as you redefine that toughness, that becomes a transferable skill, right? Because the reality is, how long does an NHL career last? How long does an MLB, NFL? I was sitting with one player recently, and as the walls came down, just like you're saying, and he began to cry and said, "This is the first time in my whole life I was able to sit down and talk about what I'm feeling. I was
Mhm.
always expected to be the dude, like I'm that guy, but this guy might play another 2, 3, 4 years, right? And we only see the periodic headline of here's a tragic suicide, or here's sort of when it was too late. How do you help these players go beyond just the performance piece and go to the identity piece of saying, you know what, the league is great,
Mhm.
my athletic identity is amazing, the jersey's cool, but this is not my whole life, right? There's something to me beyond the field, the ring, the court. How do you help them kind of develop that personal identity that's beyond their sport?
Hmm. My biggest trick for that psychologically is to pivot.
He called it a psychological trick.
I like it.
It is. It's a trick that we
Okay.
teach us
Maybe
in psychological trickery
Yeah,
school.
trickery
And
school.
that's
It's like
to-
Hogwarts.
Exactly. I left my wand in school.
Yeah.
It's I flip settings, I flip
Uh-huh.
time, I flip location, I flip person, and I help
Mm.
them see things from different perspectives so that they can see the interconnectedness of themselves to other people, to themselves in different situations, to themselves over
Mm.
time.
Mhm.
And so oftentimes when they ask me for advice, I ask them, well, what would you tell yourself if you could
Mm.
talk to yourself
Yeah.
10 years from now, or backwards?
Yeah.
And they start to see that this moment that they're in right now, as painful and as dark as it can be,
Mm.
it's just one out of,
Yeah.
it's one tiny piece of the big, big
But it's so hard to see when you're in it.
For
It's
sure.
so hard to see when you're in it. It's like, a fish in water doesn't know water is water because they're just in it so much, right? And I think
All the
David,
fish tell me.
and so it's hard to see when you're in it. I try to help them reframe it in a way such that they're a person who plays hockey and not a hockey player.
Mm.
But the tough thing about that, especially in pro sport, maybe you find this as well, is that
Mhm.
a pro athlete likely spent a good amount of their youth and young adulthood and now in at any age
Right.
training for the pro sport that they're playing.
Yeah, you're
So
not gonna
all they know is
go
that
pro easily,
sport.
yeah.
Yeah, exactly. So it's really difficult to try to separate the identity piece
Mm.
from what they do. It's like a human being, not a human doing and what have you. But that is really tough because all they know, I mean, some of these guys were in skates at 3 years old.
Wow.
So it's really tough to separate that. But I think to your point, the pivoting is very helpful.
Yeah, being able to say, I am a hockey player, I am an elite hockey player,
Mhm.
it's a double-edged sword.
Yes.
Yeah.
The good side of that is it helped them get to where they are,
Right.
undeniably.
Right.
The bad side of that is, what if now you break your leg or something, right?
Oh, the injuries are the toughest.
Where's
Yeah.
now my identity's out the window, and
Absolutely.
I'm falling into an abyss.
Yeah.
Right.
Versus getting the athlete to go from, I am an elite hockey player,
Yeah.
to, I am a human being for whom hockey is really important right now.
Yeah.
Mm.
And I'm really good at it. And I'm really good at it. It's
really
really
important
important
to
right
me.
now. Yeah. Yeah.
Top.
Yeah.
Right up there with my family,
Mm.
Yeah.
God, hockey.
Right.
Right?
I
It's
find
up there right now.
It can be a little easier when it's an athlete, if it's older athlete. Like I have a couple who are fathers
Mm.
and they recently have had children, and that has helped their mental performance actually,
Mm.
because they've said it's made me realize that there is so much more to like I go home and she has no idea what happened. She's 1 year old.
Yeah.
She doesn't know what happened. So I have to immediately switch from that role to the pivot from that role of being this player to now being a father.
Right.
So that has been helpful, but obviously that's not for every athlete at the moment. So
Mm.
I think working with somebody, is probably the most helpful thing to be able to maintain that separation identity.
And this issue of identity is so tricky.
Very.
Because we're kind of like all born into it,
Right.
right?
Yeah.
We were born to identify, to
Right.
survive.
To something, yeah.
And so it's really hard to pull away at that skin
Mhm.
without,
It is.
without hurting, right?
Mm.
We're wired to have an identity, a mask that we're willing to fight and lose limb for, maybe even
Mm.
die for, right?
Yeah.
Mm.
Just give somebody a bad look at a bar to, oh,
Right.
you don't think I'm tough enough? I am tough. I'll
Show
show
you.
you. I'll
Yeah.
risk everything to show
Right.
you that I am labeled tough.
Yeah.
Yeah.
And so it's important to normalize that we are inclined to attach ourselves to
Mhm.
identities so
Yes.
that they're more compassionate, that, oh yeah, I fell into that trap, and that's okay because that's a
Yeah.
human thing.
Right.
Absolutely.
I had an athlete once tell me, he's like, "Doc, I get it. It all sounds really cute. You
It all
tell
sounds
me
really
it's
cute.
cute." I was like, "Oh, thank you." He said, "You tell me if you lost your license and you're no longer a doctor, you're not gonna like be stressed that it's not like your identity
Fair
anymore." I
point.
was like, "Oh, that's
It's a fair
you
point.
got me. You got me." So, exactly the compassion of it, I think, for us to sort of know
Mm.
the importance of it while still
Yeah.
guiding them to, especially let's say if you're a college athlete, you're technically not. This is not your livelihood, even with NIL and such,
Mm-hmm.
right? And you're a college athlete and you're a starting quarterback, you blow out your knee. Now
It's even trickier.
it's trickier.
'Cause you don't have any like a contract and with a pro team.
Yeah,
Yeah.
but it still
set up.
hits you
Yeah.
in the core of who you are.
Yeah.
Feel for that, for the
I
NCAA athlete.
yeah. Yeah. And I think that to the point of expecting to not feel bummed out is unrealistic.
Mm,
So it really is just, to piggyback off what you were saying, it is normalizing how you're feeling is expected.
right.
So I'm not necessarily going to try and talk you out of your feelings.
Yeah.
But I also don't want you to, I want to help you find ways to not view it as the world ending, although I understand it feels like that.
Mm,
Because, you can't really blame that athlete.
right.
Yeah.
I mean, and that's why I almost wanted to drill down on this almost in a scenario, kind of way. Let's say I am that athlete now. So I just tore my ACL, right?
Mhm.
And I'm coming to you, whether I'm pro or I'm collegiate, and I feel like my life is shattered,
Mhm.
right? What tools are you walking me through? what's it look like? We talked about what it looks like to have the initial conversation.
hmm
What does this conversation look like when now I'm trying to begin my recovery process? My Achilles is gone and I'm looking at a year, rehab process. Help me, doc.
Yeah.
Where would you begin?
This one falls under mental health.
Yeah.
Yeah. What do you say to that injured athlete who's devastated?
Mm,
Yeah.
And the answer is it depends.
mm,
It depends. But I think we have to start off with saying that, as human beings, we're born with this innate yearning to connect to
Mhm.
other human beings
Mm.
and to belong to something bigger than ourselves.
mm,
And so if you're an elite athlete, that was your ship, that was your boat, that was your venue
Mhm.
to do that. Right. And in 3 dimensions, that's what lifted my family and it's going to carry
mm,
me into the future. Right. And so seeing now why it's so devastating
Yeah.
to have that happen is a good place to start. And then following it up with providing in that moment some of that connection
hmm
through empathy,
mm,
Yeah.
through presence, because you're not going to yank somebody out of the darkness.
mm,
Can't do that.
And they
It
don't want
doesn't
to be
work.
either, I don't
And we
think.
shouldn't, I
Yeah,
don't think, in my
exactly.
opinion.
Yeah.
But you know what we can do is we can sit with them in that
mm,
darkness
Yeah.
with them
Yes.
mm,
until in time, when it's right, we can come out together.
Yeah.
mm,
It's such an important aspect of not wanting to talk anybody out of their feelings because sometimes they don't want to be talked out of their feelings.
No.
And it's not the right thing to do anyway, or I should say the most productive thing to do. The most productive thing I think in that moment is for that specific player to feel like someone understands what it's like to go through something as devastating as what I'm going through.
right. Right.
And sometimes that takes a little while. It does. Even not so much injury related, but I have a player that I'm thinking about right now who's not playing because of a certain situation. And it's really tough for him because he just wants to play. Athletes just want to play,
Mm,
So whether it's an injury or they're scratched or whatever the case might be, they just want to play. And sometimes there's nothing that I can do.
right.
I can't call up the coach and be like,
Right.
the GM. But what I can do is sit with them and be like, this really stinks right now.
Mm,
Like, this really stinks.
Yeah. Martin Luther King said that, the long arch of, I'm killing his quote right now, long arch of history bends towards justice, I
yes.
think. I think as a therapist with somebody in the darkness like that,
hmm
you just know from your own experience that the long arch of healing, it goes towards hope,
Yeah.
it does come out.
Yeah.
If we're just willing
To sit with it.
to sit with it
Mm.
The
together.
discomfort, yeah.
Yeah.
Which is the hardest part. But sitting through the discomfort is so difficult.
Mm.
I mean, for myself included in any situation I may be
Right.
going in.
Yeah.
And I am not one to tell a client, this will pay off in the future because I don't know that.
Right,
I don't know
right,
if
right.
it will. But I can say, like, this is really uncomfortable right now and I know it's tough. And I also know that you're able to get through it,
Mm.
even when it feels like you
Mm.
can't.
Mhm.
Let's fast forward for a second. You walked me through the crisis moment. I'm out of the depth of that darkness. And I'm a month later. And I want to work on some strategies. I want to say, how do I approach my recovery mentally then so that I can have consistency, I can have focus. And I know, of course, it depends. I know, of course, it's case by case. But just if you can give a preview to folks to the kind of work that goes beyond the fire. Now we're going to build together over this coming year. Here are some things that we're going to approach to make this a successful, sustainable rehab process
Yeah.
from up here.
What a nice piece of evidence now we have on the
Yes.
table that you came out of this, right?
Mhm.
So the first thing is, now that we're in a safe place, looking back at that disaster zone, analyzing it and seeing what were the thoughts, the cognitions that I was really stuck to
Mm,
then that were pulling me down.
mm,
Just noticing, right?
right.
So that when they happen again, and they will,
Mhm.
I'll have a little bit more awareness
Mm,
to that. And then secondarily, maybe even primarily, exploring the pain you were feeling in that moment, that
mm,
very painful emotion of sadness, anger, frustration, hopelessness,
Mhm.
and finding meaning in that.
Yeah.
mm,
What was the meaning in that pain? What's that telling you is important to you?
mm,
What's that
Mhm.
telling you matters to you? What's on the other side of that coin? Because it's there.
mm.
And once we can find out what that is,
Mhm.
that's our roadmap to the future.
I
Yeah.
love it.
Yeah, and I think also I love all of that. It's one. I think the hopelessness is a feeling that I notice the athletes have experienced a lot in
Mm,
those moments like that. So the meaning is really important. I think it's beautiful. I think also too, um, coming from like a dialectical standpoint of like two things can be true at the same time.
mm,
It doesn't have to be black or white. There can be gray where this can be a tough situation for you to be going through, and you can work towards
Mhm.
uh progressing forward by working on the mental side of the game.
mm,
One thing when you're injured, if you can't physically do anything, you can work on the mental side of the
right.
game. That is something you can be doing. So create helping a client to change their thought process and reframe their perspective in a way where two things can be true at the same time.
Mm,
Because I think it's also important too to recognize that even a month later, it still is a bummer. There's
right.
still a long rehab process. And patience is like a lot of cliches, it's true, but
Mm,
patience is so important. But in the moment, I don't think an athlete necessarily wants to hear about patience. They want to hear about how do I deal with the frustration of having to
right.
be patient,
Right.
right? And that comes back to what you were saying about the emotion and under the self awareness of really contriving emotional intelligence.
Yeah, that's beautifully said. I think the combo there of hope and agency,
Yes.
right? Because you're
Yeah.
just wired to do something, and you want to be able to be proactive, and you feel like even if you hurt your left arm and you can still work on your right arm,
Mhm.
it still gives you a sense of there's some level of agency and meaning and control that I have,
Mhm.
that I'm not just a spectator. I'm not just kind of watching myself lose it all here. Let's maybe, as I'm going through this recovery process as an individual, we talked a little bit about parents and coaches, not when they're dealing with an injury, but from a proactive prevention standpoint, things that we touched on. If there's a parent watching or a coach watching and they're not sure if what they're seeing is maybe my kid is just having a slump, maybe they're just not good anymore, or maybe I feel like, oh, they should talk to somebody. There could be a mental performance, mental health piece there at work. What would be some of the things that you'd want them to be on the lookout for, to be, noticing in their children or the people that they're coaching?
I think the first thing is sleep.
Mm,
That's one of the first things that I think of. And sometimes that's not even sleep is a behavior, and there are sleep hygiene, there are behaviors around sleeping and our sleep
mm,
routine. But sometimes I'll even refer out to an MD or someone else who maybe is more specialized in that area. But I think sleep, first of all, and then maybe significant areas where their game has changed
mm,
on the field or again, whatever sport that they're playing. Because if you look for that, and especially if it's a different pattern than you've seen prior, it
mm.
can indicate something maybe going on. But I think sleep and some of the just day activities of daily living,
Okay.
usually if some of those are kind of off, I think is a good place to begin.
Yeah, oftentimes the smoke detector, the smoke alarm for mental health issues is the people immediately around the athlete,
Mhm.
Mm,
whether it's the family, the coaches, or teammates.
mm,
And what is the smoke that's being detected?
Mhm.
Certainly sleep.
mm,
Also, changes in appetite,
Absolutely.
right? Changes in just how they're talking, their voice, how they're carrying
Mhm.
themselves.
mm,
If you're a family member or a friend, then you probably have a good understanding of what their baseline is,
Mhm.
and you have something to compare to.
Yeah.
If you're a coach, maybe you don't have that baseline, but you know what they're capable of doing in
right.
training or in a game.
Mhm.
And if that performance is dipping,
Yeah.
if their effort or interest is dipping, it's time to ask
Yeah.
Mm,
what's going on, right? Just check in. If you're a
mm,
parent or a coach, just check in. Hey, how you doing? And if those answers aren't coming out
Yes.
quickly,
That's
and
an
they often
indicator.
don't
Yeah.
because for whatever reason, then at least continually offering
Yeah.
opportunities for that athlete to feel heard, understood, and supported
mm,
without feeling like somebody's trying to fix them.
Or to
mm,
say like something must be wrong with you. Like
mm.
Correct.
that is very like, whoa, too much for them sometimes.
Yeah. And
You guys both touched on a theme that maybe I'll ask a semi-controversial question.
Love
Sometimes
a semi-controversial
it's not even that
question.
controversial. It's just whenever I talk to athletes about sleep,
Mhm.
they say, "Doc, no, 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 my sleep is terrible, but don't worry, I take care of it by using
Yeah.
a substance
Yeah.
that shall not be named on this podcast, that is legal but accessible."
Yeah.
so
Right? They smoke.
milk.
He's talking about warm milk and
Talking about
with
warm
honey.
and cookies.
No, athletes obviously they sometimes turn to cannabis, marijuana, and
Mhm.
say like this is my sleep aid. I don't want to take meds. I don't want to be on something artificial, and just as a disclaimer, right? There is no FDA approval for insomnia for marijuana
Hmm.
as of today anyway. So, hey, how do you both approach the conversation around substances to
Hmm.
make yourselves feel a little better? And then B, is there a particular sleep trick, tool that you kind of discuss with an athlete then? Because as we both said, sleep is so important for them.
Hmm.
So how do you talk about both of these things?
Yeah. I think you have to start out by validating
Hmm.
and normalizing what they're experiencing so that the walls can come down.
Yeah, they don't feel judged.
So they don't
Yeah.
exactly.
Yeah.
And how do you do that? Lots of athletes go through this. I've seen lots of athletes struggle through this. This is really important. I can't imagine how scary it must be to go to practice the next day when you only slept 2 hours, knowing how
Yeah.
brutal training is. And so the panic one must feel at 2 a.m., 3 a.m. when I still haven't fallen asleep. Oh my gosh, I can only imagine
Hmm.
how brutal that must be. And getting them to go, yeah, for sure, for sure. And then asking them, what have they tried?
Hmm.
How has that worked?
Have you tried more milk with honey?
Have you suffered enough?
Yeah, yeah.
Because this clearly hasn't been working in the long
Right.
term.
Yeah.
Right.
There's no objective data saying that any of these substances are going to help you
Right.
athletically. If
Right.
anything, they're all going to hurt you
Yeah.
athletically. So have you suffered enough? Are you willing to try something new?
Yeah. It's really that question of how is what you're currently doing working for you?
Right.
And I sometimes when you ask anybody that, I think it's like, well, it's not. And if the answer is it's not, it's like, okay, well, let's try something different. And even if it works in the immediate, right? If it's immediately having some kind of effect, I think long term. And I also think knowing that maybe there's sometimes some self-shame of knowing the thing you're doing isn't the best thing you could be doing. And it can be helpful to help them walk through that without judgment. And I think also just presenting other options. Sometimes they don't know that there are other options and alternatives. Like what other supplements, whether it's magnesium or whatever
Yeah.
would work best for that athlete. And then also the awareness of like your breath and how you're breathing. What are you doing those 30 minutes, an hour before bed and all of that. So I think just presenting other options can be helpful and alternatives.
Yeah. And one of the things we love about athletes is that they are willing to do
They'll do
hard
anything.
things,
Yeah,
right?
yeah.
It's so helpful
Yeah.
for us.
It's actually really great.
And
Yeah.
I can't tell you how many athletes I have had come to me because they want help sleeping.
Mm.
And not one of them have I given a Z drug, an
Wow.
Ambien or something like that, because when you can open up with them
Yeah.
bidirectionally and really have a nice conversation about it,
Yeah.
they're willing to do the hard stuff that's going
Right.
to help them in the long term. That's not going to be addictive or have cognitive side effects
Yeah.
in the long term.
And I'll say even just the act of coming in a therapeutic way to talk to somebody
Right.
does relieve a lot of stress and helps them sleep better.
Yeah, I
So
feel
even-
more relaxed already right now. I could take a nap right
Your ASMR Morris, they should come see you.
I'm ready. That's right.
So even just that element sometimes can have an impact on sleep. And there's a lot of things to look at with sleep. Is it sleep onset? Is it sleep quality, sleep disruptions? Like there's so many things to look at. But I think just even presenting alternatives without judgment, and I think everything back to it kind of comes full circle to empathy. Like I know what it's like to not sleep well.
Totally.
And I can't imagine to know that you have to perform the next day. I would do anything too. So yeah.
Totally. I have all these fixes in my pocket, but you're not going to care what I'm saying unless
Yeah.
you know that I care.
Exactly.
You got to start there.
Right.
Yeah.
And then what you often find out is that for a lot of these cases, sleep hygiene is not optimal.
Right.
No, I mean
Right.
it can't. Sometimes it can't be because of the way. I mean, I know for the NHL, it's an 82 game season.
the travel
Sometimes they're back to
schedule.
back. The travel schedule is ridiculous. So it can't be sometimes. And then it's like, okay, well, how on my end, how do I help them and give them tools and ways of going about doing the best they can with what they have? Yeah.
That's a great full circle moment too. I definitely agree with you. Like the fact of for every athlete, parent, or coach to know that there is this abundance of tools that exist, right? There are these wonderful, experienced, empathetic, relatable, funny clinicians that are there, right? And the barrier is not that high.
Yeah,
Just the doors don't have to be.
the barrier is a stigma.
Yeah, and the stigmas are getting shattered left and right. That's what we're doing at the pod too.
dropping the mitts on the stigma.
That's it. Dropping the myths, you know? So as folks, or maybe as the takeaway that you'd want folks to have, either can you share any of your favorite resources, or a take home that you'd want somebody to walk away with from this conversation? I know they walked away with a lot. I'm walking away with a lot myself, but to bring it all home, I want to give you the floor.
Well, I feel like I should say something profound, but I'm not good on
Everything you
this.
say.
I'm not good on the
Dr.
spot
Naser.
with anything profound or even at all. But I think I'll just say, like, you don't know until you try.
Mm,
Like, you don't know how much it can help you and relieve you of psychological distress and emotional turbulence until you try.
mm,
And so I think I completely understand that even sitting with someone who you've never met before for the first time, it feels very vulnerable. It feels like you're very much exposed.
mm,
But knowing that, like, that person does what they do for a reason,
mm.
right? Whether it's one of us or it's somebody else, it's not the first time that they've been sitting with someone who's new to therapy or
Right.
new to getting support. So I just think you don't know until you try. And it's kind of like back to that question, how is what you're currently doing working for you? And if it's
Mm.
not, maybe let's try to seek some support.
I love that.
Totally. Which camera should I look at?
For the moment, the profound.
This one right here.
Give it the depth.
If you're a college athlete
It's a PSA.
or just an athlete, man, and you're suffering, please know you're not alone.
Mm,
The data suggests that a quarter of NCAA athletes are having moderate to significant levels of burnout, anxiety, depression. So please know you're not alone,
mm,
and there is help. And also that we know seeking help is really hard to do.
mm,
It's scary to do. Maybe you've never opened up to somebody before, or maybe you're afraid of the stigma of it. What if people find out? What if my coaches find out? Is that
Mm.
going to affect my playing time? All these very scary things that are going to show up when you're at the verge of seeking help. And do it anyway.
mm.
Do it anyway, even though it's scary, because it's the important thing to do.
Wow.
Well said.
I can't think of a better way to end the
Well
pod on
said.
that. I can't thank you enough, Dr. Aguilar, Dr. Naser. This was an incredible episode. And from a resource standpoint, I just want to also direct you to our AFH Center for Athlete Wellbeing that we put together with Johns Hopkins University. Just been an effort that we've been working on for a long time to give exactly what these incredible clinicians have had there, of just, here's a place where you can learn more, to recognize these things in yourself and your teammates and those around you. If you're a parent, if you're a coach, you want to learn a bit more about this process. How do I support those around me? That's a place of free resources right there. And I just want to thank you for tuning into this episode of our Hope Heroes podcast, and hope to see you next time, our AFH Hope Heroes. And thank you so much to
Thank
our
you.
amazing panel.
Thank
This
you.
was amazing.